My name is Rhoda Talawi, and I'm an obstetrician and gynecologist for Johns Hopkins Community Physicians in Howard County. A patient comes to me asking about how to prepare for a pregnancy physically. I have a discussion with them first about preparing for the pregnancy physically, mentally, and emotionally, and then we focus more on where they're coming from specifically. I recommend everybody takes prenatal vitamins, but if somebody is already physically fit, then generally the discussion is about continuing their current level of fitness and continuing their diet and maintaining their exercise routine. If somebody has a BMI that's 30 or higher, so that they're in the obesity range, we start to have a discussion about changing their diet to make more healthy choices. It's unrealistic to expect anybody to lose 100 pounds or more before they attempt pregnancy. So I don't tell them to aim for that. I tell them to aim to just make healthier choices and smaller behavioral changes before they decide to embark on the pregnancy. Generally, we go through the medication list and their medical history in detail, and we review which medications are safe to continue in pregnancy versus which ones we should stop or change. So if somebody, for example, has high blood pressure, there's a lot of blood pressure medications that we do change when the patient becomes pregnant to reduce the chance of any birth defects. Meanwhile, if somebody has a history of bipolar disorder or depression, we actually generally continue their medications throughout the pregnancy and actually do end up increasing the doses to help them get through the pregnancy and the postpartum period. It's important to stop drugs and alcohol before pregnancy because we know that they can affect a pregnancy, and we know that they can affect both the baby and mom during the pregnancy. Some things like smoking cigarettes, which is, a lot of people actually see that as a benign thing, but cigarette smoking it can reduce fertility, so it can actually make it more difficult to get pregnant. It can increase the chance of having early labor, early delivery, having a baby that's much smaller in size than we would hope, and having something called a placental abruption, which is a big complication that can risk the mom and the baby during the pregnancy. So we know that there's a lot of risks with these, substances, and that's why we try to encourage our patients to stop using them before they even conceive. So medical conditions that can make a pregnancy more dangerous. Some of the more popular medical conditions are diabetes, high blood pressure. Those are probably the two most common medical complications of a pregnancy. And many times people might not have the worst high blood pressure or the worst diabetes, but when they do become pregnant, the pregnancy itself sets their body on a course of making it a lot more complicated. For those women, I encourage them that if they do want to get pregnant, to make sure their medical conditions are under as good control as they can before they attempt conception. But we see people from every background and every walk of life, and we see many people who have gotten it under control and many who haven't. And when pregnancy hits, pregnancy is actually a huge motivator for most women to make changes in their life that are positive changes that hopefully they'll continue postpartum. So I like to tell a lot of my patients that, it doesn't matter what you're coming in with, we're going to help you through this. And just know that maybe this is a good thing or a bad thing, we're a little bit OCD, so we're always watching. And if something's happening, we're going to do our best to treat it immediately so that we avoid any further complications down the line.